Before we get hygiene, knocking on the door. Hi, my name is Maddie. I'm going to be your student nurse today. Can I get your name and date of birth? Great. I'm going to provide some privacy. Can I have verbal consent for this exam? Okay. Before we get started, any new skin issues, any headaches or neck pain? No? Okay. So I'm going to be inspecting the skin. So inspecting the skin of the face, upper and lower extremities, looking for skin color, like skin color changes, unusual pigmentation, lesions, scars, wounds, or edema. So the skin color matches the ethnicity. There are no lesions or wounds and no edema. So I'm just going to be palpating the skin. So with the back dorsal aspect of my hand, from the forehead, feeling for temperature, texture, moisture, all the way to the fingertips. And the skin is warm, dry, intact. And then the lower extremities, so from the hips to the toes, skin is warm, dry, and intact. Next, I'm going to check for skin turgor on the forearm, or just like on the top of the hand. So you just squeeze a little bit, and there's no tenting. So all good for skin turgor. Okay, so now we're going to be inspecting the nails, looking for clubbing or pitting or discoloration. So there's no clubbing, and while we're here, we can just do cap refill. So all less than 2 seconds. And there's no discoloration either. Okay, so now inspecting the head, looking at the hair for texture, distribution, and quantity. So the hair is straight, it's equally distributed and thick, and then we're going to be looking at the facial symmetry. So she has a slight droop in the face. And her head size is normal cephalic. It's a normal size. Okay, so now I'm going to be palpating the head. So I'm just going to be looking in the hair, looking for masses, tenderness, lesions, hematomas. So I'm going to just be looking, checking the back, inspecting all the spots of the head. Okay, so no masses, tenderness, hematoma. So now I'm going to be checking for TMJ. So I'm just going to have her feel right here and have you clench your jaw. And then I'm going to have her open her jaw a few times. And I felt or heard no clicking. So no clicks or crepitus in TMJ. So next I'm going to be palpating the frontal and maxillary sinuses for tenderness. So this is the maxillary, and then the frontal. So there's no pain in the sinuses. Now I'm going to be inspecting the neck, looking at the trachea. So as far as I can see, the trachea is midline, and there are no overt bumps or lumps. Next, I'm going to be palpating the neck. So looking again at the trachea, it feels midline. I'm palpating for pain, muscle tone, and thyroid enlargement. So with thyroid enlargement, I'm just going to have her lean forward, feel around the thyroids. There's no thyroid enlargement and no pain. So now I'm going to be palpating the 10 lymph nodes. So the preauricular, the postauricular, the jugulo-digastric, which is the tonsillar, the submandibular, submental, occipital, anterior cervical, posterior cervical, supraclavicular, so above the clavicle, and infraclavicular, below the clavicle. So the lymph nodes are not palpable. Thank you.